been mixed reaction to the National Health Insurance Bill being passed in Parliament. Government is adamant that it will lead to universal access to quality healthcare, but opposition parties and medical schemes are not convinced that the legislation will do what it promises. Frikkie Booysen recently took up the position of Wits Chair in health economics. He discussed universal healthcare during his installation. He's joining us now just to give us a sense and a reaction about the NHI bill. Prof, good afternoon. Welcome to today, and thank you very much for your time.
Good afternoon, everyone. Good afternoon, Dan.
The Minister of Health, Dr. Joe Phaahla, in Parliament the other day, after Parliament, briefing the media, he says this is the most revolutionary bill passed by our legislature since democracy, and that it will really level the playing fields in the provision of healthcare. Do you agree?
Yes, it certainly is groundbreaking. But we need to be cautious. We need to look at evidence close at home, and maybe if I can just briefly speak to the Ghanaian experience. Ghana implemented the National Health Insurance Scheme in 2003, 20 years ago. The evidence suggests that, yes, they have improved health outcomes, access is better, utilization is better, so they've moved towards achieving universal health coverage. But it's also very clear that their system, their scheme, was characterized by a number of challenges, and chief amongst these is poor quality services, political influence, and poor stakeholder participation, including from health professionals in the front line, corruption and ineffective governance, and also the failure of active and strategic purchasing to curb healthcare costs. So on the one hand, we have evidence close at home in Africa that suggests it's not easy to make national health insurance systems work. But we can also look at the piloting of our own NHI in 2012 to 17 in 10 districts in South Africa. And the evidence there also reports a number of concerns. Chief amongst these are human resources, the shortages in those, the maldistribution of those, a lack of equipment, poor infrastructure, poorly maintained infrastructure, poor supervision and management practices, health information systems that are not working very well. And of course, as a result of these hurdles, we've seen very slow and in some cases no improvements in the quality of care. So my view really is that, yes, we need to proceed. The ultimate goal of the bill is a good one, but we need to be cautious.
We need to be cautious as well on the side of fears or concern that have been expressed by a number of role players ahead of the NHI, expressing concern about widespread corruption we've seen in the public sector, for example, and a weak economy. Our economy is very weak and is struggling.
Yes, that's very correct. And in my view, what is necessary really almost immediately is a reassessment of our readiness to implement the full proposal, including costing the affordability of the scheme. As you mentioned, the economy has changed vastly and economic prospects has really changed a lot in the past 3 to 5 years.
Yeah. Now, NHI, as you've cited some examples like in Ghana and some of our pilot studies that have shown some shortcomings. But listening to the MPs the other day in Parliament, responding to Dr. Joe Phaahla, the Minister of Health, around NHI, some of them seem to think it is what we need to build our primary health care, and that should be the foundation of NHI. Is that the universal health care, the right step to take for using primary health care, NHI to provide primary health care?
Yes, by all means. Primary health care is the roadway and the gateway to universal health coverage. So it just emphasizes all the more that we need quality primary health care system. And we need, therefore, to clarify a number of details in the bill, such as those around referral networks and how referral networks will work, including between private and public sector facilities. But yes, it's definitely primary health care is very important, and it influences the effectiveness with which we can achieve universal health coverage.
Yeah, I haven't read the NHI bill as approved by Parliament the other day, and I know there's another stage that's still coming. The National Council of Provinces still has to discuss it before it moves to the next stage. But it looks like we're getting closer to it becoming a reality. Will it mark the end of the two-tier health system we have in the country?
In theory, according to the bill, yes, because private medical schemes will only be able to provide services that are not paid for by the NHI fund. So that would mean that we're basically pulling a much larger share of the healthcare resources in our country into one pool to allow cross-subsidization and to allow social solidarity. So I don't think it will change it completely because, of course, the services that are not covered in the benefits, in that instance, there may still be a two-tiered system and a public-private divide.
So those might be some specialist kind of needs.
You mean provided by private medical schemes?
Yes.
Yes, so we're talking there about a large number of curative services, plastic surgery, the things that, and I think the one danger is, and initially I think the talk was that, you know, we would have an NHI that would provide the type of minimum prescribed benefits provided by medical schemes, and to head that way very soon, in my view, would be problematic. We need to think initially about covering fewer benefits, and as you say, rightly, benefits that are in the primary healthcare sector and primary healthcare system.
Okay.
So start more cautiously with fewer benefits, test whether the system works, and then move forward with providing additional benefits, if, of course, the resources allow and if the budget allows.
Thank you very much, Prof, for your time and insight this afternoon on Today. That's Professor Frikkie Booysen. He's the Wits Chair in Health Economics, just giving us some of his reaction to the adoption by Parliament of the National Health Insurance Bill. It's set to go to the next stage in Parliament, and that will be the National Council of Provinces.